Good afternoon. I'm very happy to see you all. You are still staying to hear me. I'm very happy for that. And I thank Dr. Vijayakumar and organizers for giving me this opportunity to be with you all. The purpose of this conference is how to prolong life in a diabetic, healthy life in a diabetic. That is the purpose. So I will just tell you how to do that with evidence. So what is the life expectancy in India? They say that life expectancy is gradually increasing, but this is not about diabetics. So they say that life expectancy at birth for male and female during 2013-17 were 67.8 years and 70.8 4 years respectively. So that was the life expectancy. But being a diabetic, you know, it reduces the life expectancy. They say that, some people say that diabetes itself is equivalent to CAD. So we have to take care. So people diagnosed with type 2 diabetes at the age of 30, that's the very sad thing. We are getting patients at the age of 30, very young age. My professor, Dr. Hariharan, used to say that we are getting diabetes. If you have a family history, you are getting your son or daughter will get a decade earlier than previous, than his father or mother. So people diagnosed with type 2 diabetes at the age of 30 could see their life expectancy fall by 14 years if you don't control properly, according to a study published in Lancet. So what I want you to stress is, if you come across a diabetic who is very young, 30 years, then you have to concentrate more. I tell them, if your life expectancy is 80 and you are 30 years old, you have to take care for 50 years. So we have to impress on them. You have to protect properly from diabetes. So how to increase? So I already explained, associated with different ages, a diagnosis of type 2 diabetes in high income countries, every decade of earlier diagnosis reduces life by 3 to 4 years. So we should concentrate more on prevention. So if we can prevent, we can prolong the life expectancy. I'm going to some studies which I know when I started my practice, that is around 35 years back, 30 years. So if you remember this study, it is called DCCT. DCCT is diabetes complication and control study. It was done in type 1 diabetics, where they found out that if you can control properly and you can prevent the complications, thereby increasing the life expectancy. This is a study shows that if you give good control, your life expectancy is more. So overall mortality in combined DCCT, EDIC is a follow-up study, how these people who participated in DCCT are doing, are similar to that of general population. That's interesting. So what they found out, if you can control blood sugar effectively, you will become like a normal population, only provided it is well controlled. Mortality increased significantly with increasing mean A1C, you should remember that, and more so among females and males, especially for HbA1c more than 9. So if you have more than 9, your life expectancy is reduced. And I want to talk about UKPDS also, which is done in type 2 diabetes, where they say that found out for patients with type 2 diabetes mellitus, pharmacological blood glucose control with sulfonylureas. At that time, sulfonylureas were there. Insulin significantly reduced the risk of microvascular complications, but not macrovascular. And metformin therapy is associated with significant reduction in diabetes-related all-cause mortality. Thus, it is considered the first-line therapy. That's why we use metformin. And strict control of blood pressure, we should remember that, in type 2 reduces the risk of both microvascular and macrovascular complications along with diabetes related. So we have to control blood pressure also. Diabetes and blood pressure, they come together. So they say that managing weight, blood sugar, blood pressure and cholesterol can increase life expectancy by 3 years. This is a study for the average person with type 2 diabetes, and for people with highest levels of BMI. If you are more obese, if you can control better, you will have more life expectancy. And LDL, cholesterol, we know it's 146, and systolic blood pressure. So these three things we will remember ABC. ABC is HbA1c, B is blood pressure, and C is cholesterol. This is 3 things you should tell the patient that you have to control. This is the basic of diabetes control, A, B, C. Then the benefits in life expectancy from meeting treatment goals in the study were highest in age 51 to 60. So this is the most important. 51 to 60, if you can control, they can increase. Of the 4 treatments studied, a reduced BMI. We were reducing, talking about weight. Body mass index on average was associated with greatest gain of life expectancy, followed by reduced A1C. So first weight loss, then A1C. So the benefit of weight loss may have been underestimated since it is often connected with other treatment goals in the study. Weight loss must be maintained in the long term for life expectancy benefits to apply. So weight loss should be continued throughout the life. So why we should treat? The most important thing is if you can't become older, your life expectancy is increased. So aging, there are people who try aging, anti-aging medicines. That's important. And metformin is the most widely prescribed drug. It shows that it can increase the life expectancy. And it does not, we don't know exactly how it does. There was show that targets the age-related cell changes. So there is nothing wrong in giving metformin. And next, now we are all using SGLT2. So what SGLT2, they show that SGLT2 inhibitors to target aging. So the studies have shown that if you can give SGLT2, that targets aging also, which is interesting. In addition to preliminary experimental data suggests that SGLT2 might also have intrinsic activities independent of their systemic effects, such as the inhibition of cellular senescence, means the old age. So what they say is ability of SGLT to ameliorate the low-grade inflammation. We discussed till now inflammation. So if you can lose some weight, and it can reduce the inflammation, thereby prolonging the life. And there are certain areas in the world where people live longer. You might have heard about Japan, where they found out many people live more than 100. They studied, and Dr. Vijayakumar is telling me there is an area called Triplicane where people live longer. And they found out what are the reasons for their longevity, which I will explain. And in India also, more than 2.5 lakh voters in India are over 100 years old. And what they found out in this study is strong evidence for additional role of both diet, lifestyle changes as agents for longer life and reaching centenarian status. So if you want to be a centenarian, you have to reduce your weight and diet. So I will just talk about the religious practice with an increased lifespan, fasting. Many people do fasting, and now they say intermittent fasting. So fasting will help you to prolong your life. And I want to mention about Bhagavad Gita. What does Bhagavad Gita mention about Dirgha Ayush? Dirgha Ayush means longevity. What says Bhagavad Gita is regarded as a guiding light to the practical life. Among many lessons that Bhagavad Gita imparts is one of the increasing your lifespan. The 8th sloka of 17th Adhyaya of Bhagavad Gita says, Ayu Sattva Balarogya Sukha Priti Vivardhanaha Rasya Snigdha. This is about the diet. Krishna says about diet. It translates as follows: a person with the path of achieving good virtues prefers soft, nutritious food and tastes nice. That we should remember. Such food enhances the lifespan, happiness, health and satisfaction. I asked Dr. Krishna Seshadri Garu, what is this food? He says curd rice is near to that. So here Lord Krishna describes contribution of appropriate eating habits in living a longevity. The need to keep your diet under control is a strong base for the concept of fasting, with that people of several religions faith follow. Even Muslims, they do Ramjan during fasting. So fasting is definitely proved. And I also tell my patients this, like Vijayakumar was telling, moderation. Moderation is the key for everything. So this sloka I always remember. Yuktahara viharasya, yukta chestasya karmasu, yukta swapnava bodhasya, yogo bhavati dukkha. What he means that everything should be moderate, temperate in eating, recreation, balanced in work, and regulated in sleep, can mitigate all sorrows by practicing yoga. So Krishna already told so many things, but we are not following. So this is very important. You tell your patient that This is Bhagavad Gita 6 chapter and 17 sloka. Yuktahara viharasya, yukta chestasya karmasu, yukta swapnava bodhasya, yogo bhavati dukkha. He says that you should control moderation in your work also. A lot of us get stressed because we are working too much and we are not sleeping. They say that diabetes control is U-shaped curve. If you sleep too much, diabetes is not controlled, and if you sleep less, also diabetes is not controlled. So everything moderation. Yukta aharam, yuktam. So these are the statistics. And another interesting study is, it's never too late. What they say that a healthy lifestyle, even in late life, you can start even in late life, was associated with lower mortality risk and longer life expectancy among Chinese older adults, highlighting the importance of a healthy lifestyle in extending the lifespan, especially for individuals with high genetic risk. So currently, these things, what they found out: non-smoking, non-harmful alcohol consumption, regular physical activity, and a healthy diet. These are the things you should remember. I don't accept, but non-alcoholic consumption, but many studies. And first step to prolong life is healthy lifestyle and healthy diet. These are all the dietitians, and they will tell patients how to be healthy diet. And I want to tell you today's World Laughter Day. I want to tell you, having a sense of humor could add 8 years to your life and lead a better career. So keep laughing and you can prolong your life. That's the easiest thing to do. So these are all the stress relief from laughter. It is no joke. When it comes to relieving stress, more giggles and guffaws, just what doctor ordered. Here is why. Maybe in few years, we will give a prescription, laugh so many times a day. We don't know, because evidence is going. So this is a article we wrote with Dr. Sanjay Kalra, gelotology. Today we are having a meeting in gelotology. Please join us. And is a science of laughter. Is developing as a complementary field of medicine. Laughter therapy has been shown to have multifaceted physiological endocrine benefits. Laughter is having so many benefits, and this communication describes. So when your patient comes to you, just try to laugh with him, then do other things. Laughter is most important. Benefits of laughter: decreases stress, natural painkiller, improves breathing, helps to you lose weight, makes you look young. That's important for ladies. And no need to make up, no need for lipstick. Just keep smiling, and reduces heart disease, and you can sleep better. I presented in so many conferences how laughter helps to control blood sugar, control cholesterol, control hypertension, and even in pregnancy, if a woman laughs, the baby will be better. So from the birth to death, laughter is good. That's what we do, laughter yoga. Then, as you know, there is increased cardiovascular burden, and these are all the multiple factors contributing to increased risk of cardiovascular risk: smoking, diabetes, lipid metabolism, hypertension, sedentary lifestyle, obesity, age, ethnicity, family history, prior CV agent, and chronic kidney disease. But all these things we can't, as you know, high blood pressure is the leading cause of death and disability. So take care of your patient's blood pressure. And elevated LDL cholesterol is an important, which we don't care much, but LDL cholesterol has proven that it can prolong life by decreasing cardiovascular. And type 2 is increasingly prevalent, and CVD is the leading. Many of our diabetics, they die of CVD. So we have to control all these risk factors. And so what we should do is early diagnosis. You control blood sugar with the early diagnosis, because it is getting delayed in control. Then interventions. What are the interventions? Hypertension control and medication use. So many people, we prescribe statin, they don't use. They will stop it. And every 1 millimole reduction in LDL cholesterol reduces annual CV risk by 20%. And clinical reality is, all these things are not properly controlled. Hypertension, diabetes. Even diabetes is not controlled. Glycemic control in Indian patients is poor. So now what happened is, in 2023, we shifted from glycemic control. Our focus was, they say that previously on glycemic control. Now we are taking organ protection. So we are moving with the better available of SGLT2 and the other drugs, which are proven to protect your kidneys, heart, thereby decreasing the mortality. So these are all the things. And so what I want to tell you is, whenever you see a diabetic, take proper care of all his risk factors. I call Vijay and what should I tell? He tell early diagnosis, environmental lifestyle modifications, patient counseling, implementing therapy in achieving targets. And today is a laughter day. Happy laughter day. Please laugh with me for a minute, sir.
Thank you, sir. Very nice, very nice.
Keep laughing. Thank you very much.
Thank you very much, sir.